In this video, we are going to learn about STIs, sexually transmitted infections. Some people call them STDs. And then a little bit about what you can do about that and how to get tested and stuff. So when we're talking about wearing protection, a lot of times people think about doing this for pregnancy, right? Because, if some people are on the pill, then you think, oh, I don't need to wear protection. But this doesn't decrease your risk of contracting an STI. And these can be somewhat tricky to test for. So we're going to discuss that a little bit. So on this side over here, you're going to see the STIs listed. There's going to be some information in the middle. I will put this on Blackboard so you can download this and you will have it. And then testing right here. So testing can be tricky for a number of reasons, and we're going to get into those in a second. But first I want to talk about the types of infections. So we have bacterial infections, right, like chlamydia and gonorrhea. These can be cured, right? And so if there is a bacterial infection, you would take an antibacterial to treat that. So chlamydia, gonorrhea, there is a resistant gonorrhea that potentially can't be treated with antibacterials. So that is a problem. So be aware of that. And then syphilis is also a bacterial infection, right? So that can be treated. And then we have viral ones, right? So HIV is a virus. Unfortunately, that is only treatable, which means we can't get rid of it. Once you have that virus, you have that virus. Although the treatment is pretty good these days. So, people can live long, healthy, fairly normal lives if they do contract HIV these days. It used to be a lot worse. And this highlights kind of an important thing. Like I mentioned before, condoms and dental dams, which a dental dam is like a plastic, a little rubber piece of like square fabric that you can use for oral sex. If you don't know where to find these, and if you want one of those, right, because these can be spread genital to genital, mouth to genital, right, you can take a condom and snip just the base of the condom and it'll fold out into a square, and then you can use that as a protection layer for oral sex. So that's HIV. One of the issues back in the day was that the gay community didn't use protection as often because pregnancy wasn't a risk, right? And HIV, especially in the male population, just really spread, and it just devastated the gay community. So we want to be making sure that we're wearing protection, regardless of the risk for pregnancy. Okay, and then we have herpes, right? That's another viral one. Again, we can't ever get rid of this, but there's mouth herpes or genital herpes, and it oftentimes you break out when you're stressed. And so, if we can, we want to practice safe sex so that we don't have to deal with one of these. And if you do have one, it's not the end of the world. You can manage this. A lot of times you can't spread these unless you have an outbreak necessarily. So I'm going to show you a video. You'll have a video this week on how to talk with your partner about different STIs. And that should be a conversation to have with anybody that you're going to be sexually active with. So genital warts, again, it's another, this is HPV, right? Men, you can't test for HPV, right? So you would need to actually have like a wart that would be visible in order to be diagnosed, whereas women, you can test for HPV. And there's a vaccine now. So if you should get this vaccine if you haven't got it. Most of the younger people will have this. I was right on the barrier where I don't think I got this because I was too young. So anyways, all right, so you get the idea, right? And then we have parasites, and these can be treated as well. So we got pubic lice, some people call these crabs, scabies, and trichomoniasis as well. So those can be treated. Then we have hepatitis B. There's a vaccine for that, and C. So there's your information. Bacterial, again, treatable. Viral, not treatable. Let's look at the incubation periods. So these are kind of alarming. An incubation period is how long an infection takes to take hold, right? So for chlamydia, you might contract chlamydia, but you might not show any signs or symptoms for 1 to 2 weeks. And the issue with this is you might not be testable either for it, right? So let's say you had unprotected sex, you were concerned about an STI, so you go in the very next morning to get tested. The test might come back negative, and you could still have one of these because it hasn't had enough time to create the antibodies that would show that. And that's more for viruses. So you'll see viral STIs are going to be a longer incubation period versus bacterial. So like HIV right here, right, which eventually turns into AIDS, 3 weeks to 2 months. So you could contract HIV and your body isn't producing antibodies right away because that can lay dormant inside of you. And so that can be a real issue, right? And so we want to be aware of this if we are, having multiple sexual partners without protection. You're putting yourself at risk and you're putting others at risk with that behavior because, especially if you're not getting tested. So that's 2 months right there. Herpes can be 2 to 16 weeks, so you could contract it and you might not even show any signs until 4 months later, right? And so that can cause some problems because, well, let's say, like if you are trying to practice safe sex, theoretically you should have a partner. Like where there's one, genital warts. It can be 8 months before that incubation period is up. So, and there's no screening test, right, for HPV for men. So like you could have this and you could not know about it, and that's a real problem. So if you're trying to practice safe sex, it should be somewhat monogamous. Now you're going to do you, but make sure you wear protection. And if you're not, you should be somewhat monogamous so that you are being with somebody for a while, taking a break in between so that you know if you have one of these or not. And both of you should be getting tested. So let's talk about testing real quick. If you go in to get tested for an STI, it's not just like you go in, they give you a test and they test you for all of these. And because there's not one test and they all get tested differently. Some is a urine sample, some is just a visual diagnosis, some can be a blood draw. So here for syphilis, it's a blood draw. For HIV, this is a mouth swab. I've done some of these to like understand what it is. So like for HIV, you just go in. Boise State used to have this for free. After coronavirus, it'll probably come back. They just do a mouth swab. You sit there for 5 minutes and then they tell you if it's positive or not. So not terrible, very nerve-wracking. So you're going to be nervous if you go in to get these tested, right? Even if you don't think you have it, but it's worth doing, right? And you can also do a blood draw for that one. So you go into the doctor and let's say I went in just to like see what the experience was like. And I, told them, okay, I'm trying to learn and get tested, make sure I don't have any STIs. And they say, do you have any symptoms? And I had no symptoms. And so it's like, well, then they were like, well, what do you want us to test for, right? Because if you don't have symptoms, it's hard to decide what you should be tested for. And so what they suggested is you can get tested for the most common ones, right? So herpes is more common. Gonorrhea, chlamydia, these are more common ones. But a lot of times if you hadn't had symptoms, then it's hard to decide what you should be tested for. So that can make things difficult. And it can be quite expensive if you don't have good insurance because some of these tests are expensive, right? And so ideally, you would show some symptoms, then you go get tested for the ones that meet those symptoms. So you're specifically diagnosing what the doctor would be concerned about, and then you can deal with that and treat that if you do tend to have it, right? And so if you do get an STI, it's not the end of the world. And again, we need to make sure we're wearing protection for more than just pregnancy because these aren't the end of the world, but they're not the funnest thing to deal with either. And if we can, avoid having to deal with these because we're being responsible, that would be most ideal. So, okay, that is good for this video. Follow the Blackboard prompt and answer the questions, and I will see you in the next one.